Good afternoon, everyone. My name is Maurice Washington, Director of the Michigan Athletics Career Center. We are super excited about this series, medical series, our medical webinar. Our doctor is in. We got some amazing people that's on this call today. We have Dr. James Wasco, who leads our medical advisory program for our student athletes. We have Dr. James Williscroft, who's also a medical advisor and former dean of our University of Michigan Medical School. One of our amazing student athletes, Caroline McGee, who leads our athletes in medicine. You'll definitely hear from her later on. And then the staff, I have Julie Fielding, who is our assistant director extraordinaire. And then we have Cody Riffle, who leads our employee relations. And so at this time, I want to hand it over to Dr. Williscroft.
Great. Julie, yes. So we are really privileged today to have our Assistant Dean for Admissions from the University of Michigan Medical School, Dr. Stephen Gay, join us. He is truly a nationally recognized expert in the whole area of admissions. Just a little background on Dr. Gay. He was a two-sport athlete at Yale, and so he understands from personal experience the necessity of superb time management, how you balance athletic requirements with academic requirements, and has really walked in the shoes that many of you are walking in now. Following his graduation from Yale, he went to the University of Illinois for medical school, then Michael Reese for his internal medicine residency. He came to Michigan, where he did a pulmonary and critical care fellowship and has stayed on here at the University of Michigan ever since. Before many of you came on, he was just relaying that his time as the Director of Critical Care and Support Services will be coming to an end as of 4 days from now, I think he said. But Steve has been really at the epicenter of our ICU care for COVID patients over the last 2.5 to 3 months. And so he has had an incredible impact on what we've done at Michigan Medicine over the last few months, and actually for years as the director of the ICU. So with that, I will turn it over to Steve, because as Jim Wasco said, he truly has incredible insight, experience, and most importantly, up-to-date information on the whole area of medical school application, which is, as all of you know, in great flux now. So Steve, thank you for joining us. On behalf of all the athletes, it's a real pleasure to have you with us today.
Thank you very much, Dean Williscroft. It's an honor. Thank all of you very, very much for allowing me to speak and talk to you. To say that this is a crazy, surreal time is an understatement. The things that every single person in our communities and societies has to go through is extraordinary. And for all of you as students and athletes and individuals who are thinking about going to medical school, whether it be applying this year or in the future, you've got to have a whole lot of questions, because our normal has been turned upside down. So let's start with a few of the things that you might be thinking about and a few of the things that may give you significant concern. There have been a number of changes related to the pandemic that AMCAS and the medical schools have done. And there are a number of things that we are being very, very proactive to do in terms of how the University of Michigan is going to do this. So for many of you who were planning on taking the MCAT this summer, the MCAT dates have been canceled. The testing sites are not open, and they have been slow to reopen. And so students who felt that they were going to wanted that great MCAT score to be on their application at the time they apply within the next couple months don't have it available anymore. We as med schools know that and understand it. We have made active decisions because of this. Many schools that didn't already are extremely de-emphasizing the MCAT. We understand the difficulties that you have going through trying to take it. We at Michigan have always used a very holistic approach to evaluating the application. We want to read the application and know the context in which you have succeeded and the things you've had to do to be the best person you can be. And so knowing that the MCAT is a very small component of that and not a direct measure of how well you'll do in medical school, we take that into account. But this change is forcing a number of other medical schools to do the same, and they are now doing even better to read your application completely. We are aware that all of you who are in school now had to go to online learning in the spring, and we know as a part of online learning, and we think it's an excellent thing that the undergraduate institutions have done. Almost all the undergraduate institutions immediately went to all of your grades during that time being pass-fail versus letter grades. Now, in the past, some institutions, not ours, used to say, we're not going to take a bunch of pass-fail grades. All of the medical schools now are completely open to it during this time frame, and they are well aware of the reasons why, and they are not going to hold that against you. So if you feel ready, I guess the point of both of these is to say, if you feel your application is truly a complete one, if you can show the person you are, show your academic achievements, show how you've excelled in so many areas, such as your athletics or altruism or research, then by all means, apply to medical school. But if you were waiting for one specific thing to make you a good candidate, I needed a good MCAT score to be a good candidate for med school, or I needed my grades from this semester to be all A's, so I'll be looked at as a good candidate for med school, then you may not be ready for med school, because there's so many other factors that go into what makes you a quality candidate. If you feel you are lacking those and you are looking for the bottom of the ninth home run to make this possible, then don't worry about it. Take the time to prepare yourself to be a better candidate and look to potentially apply next year. We realize that with many of those activities, people planning on doing a significant amount of volunteerism, that's limited. People who had opportunities to do fellowships or do research in certain places, to travel and go to them, those things weren't available anymore. That doing things as everyday people to care for the people around us and to explore and be curious about our world, you're not able to do because of social distancing. We know it and we understand. We realize that for many of us, going home to begin to take classes may not be the best way to take classes. And it spans a whole different reasons. For some folks with socioeconomic difficulties, they may not have good Wi-Fi connections, or they may have not necessarily the best place to study. For people who are of significant means, sometimes going home means being surrounded by your little brothers and sisters and your mom and dad, all wanting to get into the things you do, and the rhythms that you have to be diligent and study and concentrate and have that quiet in any of these situations may be taken from you. We understand that as medical schools. And so we do know and understand that you may be going through an enormous amount of change that was both unexpected and is dramatically impacting your ability to perform. Just in the same way that dealing with the pandemic itself, from wellness issues, from mental health issues, has been difficult, has been a struggle. We are taking all of that into account as medical schools as your application comes through, giving you credit for doing the very best you can to get through this extraordinary time. So know and be aware, and I do speak for all medical schools here, but I can speak best for my own medical school, that when we read an application, we are reading it from beginning to end. We are reading the context in which you have had to achieve, the things you have had to overcome to be the students that you are, and that when you put your application together, by all means, let that show the person you are, show the things that you have overcome to do what you need to do and to be the student you are. And that will give you your best opportunity to be looked at as a strong and exceptional candidate for medical school. We can go to the next slide, I think. So You'll find out about all the medical schools and about a lot of the admission requirements and how they're changing by going to the AAMC's website as part of the MSAR. You can see each and every school, what they need, the types of grades that they have required in the past, the types of activities, the type of school they see themselves to be. And it's very important as you apply to medical school that you go about the process to find places that best fit you. If you are interested in being a primary care doc, then look at the places that make outstanding primary care physicians. If you are interested in being an academic physician, whether in clinical translational research or bench research, look at those institutions and those medical schools that can best prepare you for that. Try to make your goals match the strengths of each and every medical school. Next slide. So a couple things are changing for us as medical schools. We are not going to have access to files for an additional couple weeks. This gives you a longer time to complete your application. As stated, we're going to take pass-fail grades. We are not going to look at the impact that they would have. We don't see it as a negative of how it will affect your GPA, and we are not going to use the calculation to determine that. Online lab courses are going to be accepted through the time that the pandemic ends, just as any online course will be accepted. All of us are extending our application and secondary deadlines. There are more MCAT dates being added, but we know that that is still going to be something that creates stress and difficulty. So many schools, just like mine, are happy to look at applications without an MCAT score because we feel comfortable holistically evaluating you and determining whether or not we are the right institution for you and you are the right institution for us. Next slide, please. So it looks like there are going to be multiple exam sittings a day for the MCAT, and it's going to be a shorter exam. The turnover for the grades through the AAMC, not from the AAMC, but through the MCATs is going to be quicker, and all the information is going to be turned over much more quickly. We are going to accept MCAT results that go farther back if necessary, and we are clearly going to review MCAT score applications without MCAT scores. But before we give you an offer to med school, we will want to see that you've taken the exam. The vast majority of us are going to a virtual interview format, and we are all working very hard to try to give you the best experience we can. This means that you're going to have to be creative in a number of ways in finding out the culture of each medical school. This is quite important because, as all of us know, when you're in a place that you love, when you're in a place that's supportive of you, you tend to thrive. And we want you to still be able to make those decisions, even though you can't visit early in the application process on site at many places. We're all working on producing content to get to know us. We're all hopeful that as we get closer in the spring, as you're trying to make your decisions, you'll be able to have visits. But we're all working to the best of our ability to give you clear information and vision and understanding of who we are. There are things you can do to help that, however. The one wonderful thing about the University of Michigan, it is probably the largest alumni network in the country, not only for medical schools, but for undergraduate as well. Speak to folks. There are Michigan graduates at every medical school in the country. Talk to them, speak to them, see what they feel about the culture of where they are and how they're taught and the access they have to the people teaching them. See what it's like to live in the communities or the cities that they're in. Prepare yourself to reach out to folks that you may not know too well to try to help them give you the best opportunity to understand fit for yourself. We are actually messaging all of our alums right now as a medical school for our residency, for our folks going into residency, and saying, please be available to these folks. And the wonderful thing about Michigan graduates and Michigan alums, they are open, willing, and excited to try to help you find the places that fit you the best. So you're going to have to take advantage of that through what is going to be a difficult time as you're working to find out what may be the best places for you to continue your education. Next slide. So with that, let me talk about a few things before we go into questions about what makes a great application. First and foremost, your application should be about you. You can't worry about saying things that you think I, as an admissions person, want to hear or that schools want to hear. More than anything else, we are trying to find the context of your journey. The context of anyone's journey will have successes, but also things where you struggle, where you've had to be resilient, where you've had to overcome. In our line of work as physicians, every day something like that happens. I am in my ICU right now, and not a day goes by where there is difficulty, where there are things that we are doing to fight for our patients and have them do better. We need to know that you have the strength, the competency, and the ability to deal with such things. You don't have to be apologetic for your struggles, but it's important to show how you've overcome. It's important to show how you are curious. It's important to understand how you are driven to find the things that you are passionate about and embrace them. You know, not everybody has the same things that are important to them. We are very comfortable and confident in the fact that we are not trying to admit a class of exactly the same medical student, majoring in the same thing, same level and time of activities, coming from the same part of the country. We embrace the diversity required because our field embraces that diversity. We need athletes. We need people who know how to lead, who know how to work as a part of a team. We need people who are artists, who are creative, who think outside the box. We need people who are extraordinary communicators. We need extraordinary researchers. We need them all to be a part of a class so we can put together the best class to learn from each other. So don't try to be the perfect medical student. And all of the things that you try to learn and involve yourself as a part of, take from it, what is the type of person I am becoming because of it? If you're an athlete, the things that you learn being a part of a team, working toward the same goal, especially when the stakes are higher, are so unique. And if that's a part of you, by all means, let us know why. Let us know how. Show us the context in which you have become the extraordinary individuals that you are, and show us why that will make you a great physician. If you are able to do this, your application will be wonderful. And a whole lot of us will be fighting for you to be a part of our medical schools. In every communication you make, in every interaction, be confident in the person who you are, and know that that's what you are trying to show these schools. Show them why the connection between the two of you will allow them to be proud of the person you are and the physician you will become, and will allow you to have the experiences to become the physician that you've dreamed of. So with that, I'm happy to take questions if we want to start questions on anything. Now, I think the way to do the questions might be, I can't see all of you. So if you want to relay them through the chat and type them, or if someone can control everybody speaking up, if they can see everybody, I will answer anything you want answered on any of this, even about this whole COVID-19 madness and how it affects everything else in medicine, let alone how it affects medical school admissions. And first one who asks a question will get into med school. Who's first?
Steve, why don't I ask a question
Well,
first?
you've already been into medical school.
So we get lots of questions in the counseling programs about the importance of early filing. So can you speak to that a bit, particularly now that you're not going to be receiving completed or verified applications 2 weeks later than you usually do? What's the importance of early filing?
I think the importance of early filing is actually, excuse me, strangely a selfish one. I try to read a majority of the applications we get. Now, when I say that, you have to understand, last year we got 8,200 applications for 170 spots. I have reached the point where I now feel comfortable getting through personally about 4,000 of the applications. My director of admissions reads another 1,000, and then our extraordinary screeners They tend to take care of about 2,500 of them, and that leaves about 500 to 800 that don't get read, but we have the ability to look for the characteristics we are looking for. Getting your application in earlier actually helps to determine where it is in the queue of reading that the vast majority of us are doing. So if you have a complete application that is strong, get it in. If you are waiting for things to make that application strong, you should ask yourself 2 questions, especially in this year. Is knowing that there will be other people ahead of me, is my application still going to be strong enough with what I'm putting forward that we're going to wait for this? Or does it make more sense for me to take a year, add some things to my application that I think are extraordinary, and then apply? I regretfully can't answer that for you, and I also cannot define it. The folks that can define it, you've got a few of them here, and Dean Woolscroft and Dr. Wasco. They know and understand what we are looking for in an application. They know and understand what our medical school is looking for. I can honestly say that my knowing what my medical school wants was directly shaped by a whole bunch of conversations I've had during my career with Dean Woolscroft. He has had a vision for what this place should be and how we should educate that has been transformative to who we are as the University of Michigan. And so you have folks around you that get it, that understand what's important to us, that's important to the type of physicians that we are trying to produce, and the qualities and characteristics that we find necessary to try to assure that we can do that. Take advantage of those folks. Take advantage of other physicians around you that have been a part of the system and who are transformative, who can also help you. You have to reach out for these things to begin to learn what that is. But to kind of go around to the question, if waiting for something is the one crucial factor to make your application strong, I'll be honest, with the uniqueness of this year and what we're all having to go through in the pandemic, it may not be the perfect year to apply if you feel everything hinges on one specific thing of your application.
So Steve, really to follow up a little bit on Jim's earlier question, some students I know are really concerned about being able to drop their application at 1 minute after applications open versus 1 day later.
No.
As long as you're in the first wave, does that make any difference?
Exactly. As long as you're in that first wave, and that first wave usually lasts about, I'd say, a month, 6 weeks, you've got a great chance of getting into every medical school. There's no problem with it. The population I tend to look at, and I guess the easiest way to put it is to give you an example of something that happens occasionally in this office. The application cycle for most schools ends either October 1st or October 15th. Ours ends October 15th. I have had situations where students have mailed their application on September 25th and called my office a week later and asked why I haven't read that application yet and given them a decision of whether or not they are to be interviewed. That's a little hard because you have to understand, as rapidly as I can go through an application, and doing this for 15 something years, I can get through an application knowing what I'm looking for at a pretty good clip. Nobody can read that fast. And usually by that time, I have given away about half the interviews, and I probably have about half the files still to read. And that's where it gets more difficult. We are not comparing one student to another, but when you come forward as a unique applicant, and that's the one thing about our varsity athletes, they're always unique applicants, so they're always going to be read. But when you come forward as a unique applicant that has done some amazing things, we're likely going to see you. But we would rather do it earlier as opposed to later. plain and simple. But no, it doesn't have to be within the first day, doesn't have to be within the first week. You get it in within that first month or so, and you're in great shape. You really are.
So there's a couple questions. There's a Kate that posed a question. How does the pandemic affect applications for PA school? I think you probably touched on it a little bit, but she's referencing PA.
PA schools are going through the same struggles we are. I have gotten a sense through my connections with a few PA schools that they are making the same decisions we are. PA schools have historically, however, been not quite as holistic in their reading as we are. And so they're still really keyed into a lot of the numbers. I don't know what they're doing with the testing portions of it, but they understand that those numbers will be changing, that you are going to have students that were going to do a lot of things in this year that they are unable to do. And so I think they realize it, but I don't know exactly how they're going to deal with it. Historically, they have taken a number of cues from how we do medical school admissions and how the nursing school does admissions. And both the med schools and the nursing schools are now very committed to de-emphasizing things like the scores on exams and understanding that we're going to see more pass-fail stuff and reading the application more holistically. So I think the PA schools will follow suit. I can't speak specifically to exactly where they are, however.
Okay.
Steve, can I forward another question before Mo has one?
Mm-hmm.
And that is one I hear all the time about the MCAT score. They'll look at the MSARS report and find that the average MCAT score is 85th percentile or 90th or whatever it is. And then if they don't get what they're shooting for, they worry about, should I take another exam, another run at it? Can you speak to that a little bit, and how do you deal with multiple MCAT scores?
We're very comfortable with multiple MCAT scores to a point. So let's say that you felt something actually happened or just didn't feel like you performed at your best. No one is going to fault anyone for taking the second MCAT. But if you get exactly the same score within a couple points of that second MCAT, to take a third or a fourth and keep getting the same score over and over, there's actually psychologically a bit of an issue there, to tell you the truth. We certainly realize that things do happen, things happen at testing sites, things like that. And some days you get up and you just didn't feel you did your best. So no one is going to argue when someone has taken it 2 and even 3 times. But I have seen applications where people have taken it 5, 6 times, gotten the same score. That isn't real helpful. In some cases, taking it over and over in a very short period of time, people do this, and that may not be the right thing to do. It may be that what you need to do is step back and wait much longer and re-prepare to try to give yourself a much better score if that's what you're truly looking for. So understand, we look in context. We understand that there are so many factors that can affect a good MCAT score, especially now. I was telling my team today that I am unsure how to look at any MCAT score from this year. I truly am. That the stressors that come with having tests canceled when you were preparing and having to take it in a few months later, I actually think that it may increase the pressure, it may increase the anxiety, it may increase the difficulty. Those of us who study and study and study realize that sometimes you get so tired of studying that you lose that edge a little bit. I just don't know how to interpret certain MCAT scores anymore. So, and what do I mean? Let's say, yeah, everybody publishes their mean as part of the MSAR or their average, and understand that it's a mean or an average. What you rarely see are the ranges at which we admit folks. And those ranges are important. For schools like us and most of the other top schools, sure, we love to have a high score, but more importantly, we're concerned with what our floor is. We know those scores that tell us you may have more trouble in our curriculum. And so we look to avoid scores lower than that. But for the most part, we look at the context in which you've had to learn. We know how expensive this process is. We know how expensive it is to take courses to try to prepare for it. We know the time constraints of our athletes to try to take these courses when they are already under enormous time constraints. We get it. And so enlightened institutions will read these things in context and go, well, you know, it's a perfectly good score from a great candidate. I'm not worried that the score is 80%. This person can do our work. We're fine. And we can go on about it. Now, there's certain scores, as you get lower than that, that we begin to be concerned that it may be more difficult to do the work. But in truth, we don't see that many of those applications. Does that help?
Yep.
Okay.
We do have a
So-
few, oh, I was going to say, we do have a few questions here in the chat. Just want to cover a couple of these as they are starting to pile up a little bit.
No problem.
Couple of the questions here. Would pass-fail classes be considered for all years and not just current applicants, specifically underclassmen?
So I think not just this year, but for this period of time, we're all extremely comfortable with it. So let's say that you are a sophomore. Your classes were changed to pass-fail at this time. And so 2 years later, you apply and we see all these pass-fail. We know that that was the time of the pandemic. I think one of the concerns we have is we do see that you believe enough in your academic strength to challenge yourself and get a grade. So when you go to the University of Michigan, we do know that sometimes you have to take a course outside Michigan because of the time constraints. But yeah, we would look poorly on someone who took all of their core courses, even though we don't have specific core courses here at the University of Michigan Medical School. We tell you what you need to take, but how you take it, we don't care. But a lot of places will look and say, yeah, you went to Michigan, but you took every single core course for us at Washtenaw Community College. Washtenaw Community College is a very good college, but the competitiveness of the University of Michigan is higher. And you're learning from people who write the books instead of read the books here. And it's a greater challenge. So you'll want to see students do that. We understand that occasionally you're going to have to take a pass-fail course because of scheduling. You're taking something extra. You're taking something unique. But we also kind of understand that it's okay to challenge yourself, and you don't have to get straight A's to get into medical school. And sometimes that B you got in Kierkegaardian philosophy is probably the finest grade you have ever gotten because of how much you learned. We get it. That's what it means to read an application in context and understand holistically who the person is trying to become.
We have a question pertaining to a personal statement for an application. Do you think it is important to include experiences from athletics, even if soccer is not why I am choosing medicine, but I want to demonstrate how it has shaped me as a person? Or should I focus on experiences that made me realize I want to become a physician and leave soccer to activity section and possibly secondary prompts?
I think it's both. Understand, what we want more in a personal statement is not just a list of all the things you've done, but the things that have been transformative to the person you want to be. What are the qualities that exist within you that make you exceptional, that are the best parts of you? For many of our athletes, that competitiveness, that ability to lead, that ability to be a part of our team, the ability to overcome adversity and be resilient are core values and qualities that make them exceptional. Your athletics can be the best way to describe that in a number of different ways. So it shouldn't be simply one note. There should be other things in your life that also support that narrative. And giving another example of things outside athletics supports even more that it's about the person you wish to be. But I think it's a very important thing to show what you have gotten out, the why you did things, the who you've become, and not just what I did. It's that depth in a personal statement, that self-reflection, that introspection that makes an incredibly quality personal statement and really makes you the type of person we're interested in interviewing, because we want to meet a person of that type of insight and depth.
Awesome. From Kate around PA school. For PA school, you need a minimum of 1,000 patient care hours to apply. How can you start working on getting these patient care hours in during this time, since a lot of the in-person work is restricted?
So this is one of the problems that I have had with my colleagues in PA school. As I have told them, patient care hours can be counted as anything. All right. So if you go to the University of Michigan Hospital and you volunteer to push the ART cart around, and I have no difficulty with pushing the ART cart, I think it's a wonderful thing. But am I really going to compare 300 hours of doing that to 50 hours of being a primary caregiver at a hospice? Those are two incredibly different quality experiences. So you can begin to get those patient hours in other ways to some extent. In a lot of situations, you can look to be a caregiver in any way, shape, or form. So showing that you are going out and caring for others can help with those patient care hours. And when you look at our society at this time, there are so many people in need in extended care facilities, in nursing homes, in people who are homeless and going to our shelters. And in many ways, you can put that narrative into patient care hours as well, and that can be somewhat helpful. But right now, it's going to be limited. And I do believe our PA schools are going to reassess that and say, look, this person has 750 hours, but they had an entire year they couldn't take it. They couldn't do it. I'm okay with 750 hours. I think you'll see that they will begin to make those moves as well as anybody else. I think you have to. Someone who doesn't acknowledge the incredible devastation this pandemic has put on our daily lives and our ability to achieve the things to make ourselves the best candidates possible just doesn't get it. And I can't think that these institutions of higher learning would be that callous to not understand that.
Awesome. Max is wondering, is it a good idea to put your gap year plans as a unique experience?
No. And what I mean by that is you'll always have periods where you can update your application. But it's always a weird thing to put future hours and future things because plans get canceled, all right? There are a whole lot of people that were going to do a summer at the NIH this year. And they put that on their application, or we're putting that on, and guess what? It isn't there. You have to be cautious with that. There's certain things where you can describe what you want to do and what you're thinking of doing in your secondaries and things like that. But to put things that you're going to do in the future before you've done them is a difficult paradigm. None of us who read applications likes to see people who have started things a few months before finishing school, yet they put all the hours that they think they're going to do before they reach the day they walk across the threshold of that medical school. That doesn't look good. It doesn't look right, because part of your activities and your experiences should be what you are taking from them and getting from them, not simply that you've done them. And so it's very hard to speak to that portion of it if you haven't done it yet, or if you've done it for a short period of time. I mean, one of the things that always sometimes upsets me when I read personal statements is someone will talk in a personal statement about something they've been doing, but then you look in their application at how long they've done it, and you'll see they started it a month before their application went in. Can I really say that you've had the time to reflect and understand what you've done to that extent to make it a crucial part of your development in your personal statement? I'm not sure. It doesn't feel right always. So you have to be cautious with those future events and future activities.
So Steve, building on that, one of the things that I've told students is not to put on papers in progress, posters in progress, etc., as if that is a certitude as well. What's your opinion on that?
I have to agree with it. I have to agree with it. Yeah, there may be a few institutions out there that are counting your papers and counting your abstracts. But more importantly, when we look at your research, we're looking at the quality of the research. We're looking for the folks you've worked with and the understanding you've gotten about the scientific method, how to conduct it, that you were doing a lot more than just washing glassware and killing mice for somebody else's project, that you've gotten responsibility for doing things. We understand that in many labs, you may do wonderful work and never even get a chance to get on a paper. We also understand that some labs, they'll let anybody who walked in the door be a 6th, 7th, 8th author. I think it's more important to describe what you did in the research project, how it was formative to your understanding of research, how it may have piqued your curiosity and your interest and made it much more about the person that you're becoming.
Got one more question in the chat box here from
Cody.
someone.
Sorry, can I ask a quick follow-up
go
on that
ahead.
question about future activities? Dr. Gabe, thank you so much for taking time out of your busy day to help us. I really appreciate that. Just a quick question. Does your advice on future activities change if the experiences are 100% secured and they sort of got delayed and out on hold because of the pandemic?
I have difficulty with anything being 100% secured in this time of the pandemic. I'll be honest. I don't think it changes because of that. I think you can write about it in other places other than directly listing it as an activity or an experience, where at least part of the listing of that should be the qualities that you gained from it. Does that make sense?
Yeah.
I mean,
Yeah,
especially in the
makes sense. Thank you.
secondary, we all ask about your future plans and what you're going to do and what things you're going to do between now and med school. That's a great place to put it because we read that with the same importance. But I think it's a very dangerous thing, especially in this time, to list anything until you've started it already.
Perfect. Thank you.
Joseph has a question. With the AAMC recommending online interviews and many schools interviewing virtually, what are some of the best ways to excel in a virtual interview? Will it be a day-long call?
It's hard to know how everybody's going to do this. We are actually going to very closely mimic our normal interview day. You'll have some experiences to learn about the place. You'll have a couple 30-minute interviews and maybe even a third, and then you'll have some shorter interactions to look at very specific competencies. Dress professionally, be ready to go. Make good eye contact, which is the hardest thing to do on a screen, but will probably give you a little off. But those that can look in the screen like this and talk, that's good. But be yourself. Be confident, be comfortable, know your application, know who you are, know what's important to you. Those things do not change whether it is a virtual or an in-person interview. It is about making connections with the person. Try to assure you have as good a Wi-Fi hookup as you can. We are going to be very, very understanding that there may be some difficulties with some folks when they work to connect and things like that because of where they are. Try to find a quiet place where you can do it. Not sure coffee shops are going to be the best place to conduct your interviews, but know that you'll probably be on the computer for a couple hours at the bare minimum, because we are going to want to take that opportunity with you as an audience to show you who we are as much as we are going to try to get all the information we can to make the best decision possible from the type of interviews that we want to give and the type of information that we are trying to elicit.
Steve, what about the MMIs virtually?
I think some MMIs can be done virtually. I think some of them can't be. I know that a lot of folks are working to be very creative with it. And so you will find that you will have these shorter interactions, these multiple mini interviews, and many of them will be more didactic. I think that's the thing. I think you'll see more role-playing ones and more question discussion ones than a lot of participation ones for a lot of folks.
It's the end of the questions in the chat box. If anyone else has any general questions.
Well, we want to thank Dr. Gay for coming along and giving us this amazing information and expertise in this area. We know that there are other questions out there, other topics. I want you all to know that this is our webinar series, our upcoming. You can look at that. So the next one will be the gap year. We're talking about, I think it was a gap year question. So we'll have a whole webinar on the gap year. We ask that you come back and join us. But before we leave, I want to talk about how we made this happen, right? We have this amazing pre-professional program called The Doctor Is In. And that's our staff, as you see there, Dr. Wasco Woolscroft, our student athlete, Carolyn McGee. But I want Dr. Wasco to talk about, again, how we made this happen for our student athletes, because this is one of its kind for student athletes, for those who are on the call here on this webinar and not a Michigan student athlete. And I did see that we have Dr. Roy here that's connected with the AAMC, so we welcome here from Western Michigan. But Dr. Wasco, could you kind of give a brief overview of the Doctors In program, what we're trying to do and how we were able to make this happen?
Sure, Mo. We actually started the Doctors In program about 7.5 years ago, recognizing that student athletes can bring a wonderful set of proficiencies to medical school and to the medical application program and as physicians down the road. And so when we started the program, we were focusing basically on medical school and medical school applications. And the idea would be or is still, to have 1.5 hour to hour interview sessions one-on-one in the context of the Career Center, but during periods of times when we're not available in the Career Center, to be able to do that virtually. And we've maintained that in the 3 months since we've been handicapped by COVID. So what do? Basically, we introduce the field of medicine, what it's like going to medical school. We try to put people in touch with students who are currently in medical school so they can understand what the experience is like. We help them at an early age in undergraduate school, freshman, sophomore years, to know what is important to do in order to supplement your activities to prepare yourself well for medical school. That means the kind of volunteer experiences you should have, the kind of research experiences, the clinical contact hours that you should have. And we provide them with access to community facilities, research professors, and others who can help them accomplish that. When it comes time to actually complete the application, we give people advice on their personal statement, how to go about completing the application. We don't do anything for people. We just really show them the door and try to nudge it open a little bit, but make sure that they take the responsibility to do these things themselves. In the 7.5 years of the program, we've seen 200 different student athletes. Actually, 65, to my knowledge today, have wound up applying to medical school. 51 have been admitted to medical schools around the country in 17 different medical schools. And there are some that are still waiting to see what happens this year. So the results are pretty good, largely because we encourage people to maximize their proficiencies and to really prepare themselves well. So our statistics might be a little inflated compared to others, largely because we're really we try to give the best advice we can. And some people decide that medical school is not for them. So that's why we've had 200 students, but only 60 have applied to medical school. Many have decided that it's not for them. A year and a half ago, we decided to try to increase our programming. And so now we deal with students who are interested in PA programs. We have dental programs, and now just starting with a dentist who's in the community, who's well-known and established, and she gives people advice on that. Mark Mooch, who's the charge PA at the medical center, acts as a volunteer helper to educate people about what PA school is like and to help them with that application process too. And it's growing. 2 years ago, we started a medical conference where we had many specialists present what they're doing. and give their perspective on medicine. We had a repeat this coming year, inviting students from Eastern Michigan, and our plan next year is to expand it even more. This webinar series is another phase of our growth. We're in constant contact with Dr. Gay and with Carol Tiener from the medical school. We get their advice for how best we can prepare students. We try to engage them in the program and make sure that they know everything that we're doing. So that's basically where we are so far. And we look forward to growing it and making it even better. So Steve, do you have any comments about that? You may be muted.
You might be muted, Dr. Gay.
Unmute myself. Thank you. You can hear me now?
Yeah.
I got to tell you, this program has been extraordinary, and I can't be more pleased and proud that you guys have both put it together and have kept it running at such a high level. Jim kind of said it a little bit. I have a personal affinity for our athletes. I really do. I know what being an athlete in college did for me. And I also know what it didn't do for me. I knew the time constraints. I knew the difficulty. I'm extraordinarily sensitive to both the triumphs and sacrifices that y'all make to do this. Jim knows, both Jims know for a number of years that we have discussed how to even the playing field for our athletes who do so much for us. And this program does it. I think it is crucial. I think it's necessary. And I am just so pleased at the quality of the candidates that come through here and get accepted to the institution. So I am very grateful, and I'm grateful for your participation. I am grateful for all of you for everything that you do for this university. And I think it makes you extraordinary candidates for med school, so keep up the good work.
Hi.
Thank you.
I'm sorry.
Go
I
ahead,
don't know if I'm allowed to speak. Sorry, my name is Michaela Shemp. I go to Eastern Michigan University.
Sure.
And with all of these, like the doctors that they're talking about, is there
Doctors Wasco and Woolscroft. Because I don't personally advise anybody.
right, yeah, sorry.
It's kind of out of my job description. But I'll leave it to them to answer.
Okay.
Dr. Wasco?
Yeah, well, we have not opened the advisory program clinical hours and the advisory hours to people from outside the university, largely because we have such a large volume of students at Michigan, and it's supported by the University of Michigan. So it's been restricted to those students who are currently students and also ones who have graduated. Now, what will happen in the future, I don't know. Outward programs, the kind of that we saw at the stadium this year and last year, where we have community outreach, certainly we're inviting people to those, but we have not so far made ourselves available for one-on-one counseling from students from other schools.
Okay, thank you.
Along with this program, this program had many variations to it and why it's growing, as Dean Gay has mentioned. One is our athletes in medicine. So how do we get our student athletes involved? And we have one here, Caroline McGee, who is a sophomore on our rowing team. And I want her to speak about her council, and she may have some questions for her.
Yeah, so when I thought about, bringing this committee back, Mr. Washington had said that they had started it, but then it just kind of like fell through a little bit. And I am interested in the healthcare system and doing something in medicine, maybe nursing. And we were kind of talking about what opportunities were out there. just like one-on-one. And he brought up this idea along with Dr. Williscroft and Dr. Wasco. And I was really excited about it because, you know, it was kind of like a way to find opportunities for a lot of people and just help them kind of navigate, you know, how do we get these opportunities when they're not as easy to find. So I mean, that really made me excited, but definitely through like my whole process of looking at just like different opportunities that may be out there, I found it really hard to understand different things. So I feel like having this committee, it can help not only myself, but also many other people. And that's kind of something that I'm very like passionate about right now. And I really want to have this as like a tool for everyone to use, and just kind of like, I don't know, use it for any questions or needs that they may have.
Okay, thank you, Caroline. So I see we're going to continue to grow. We have a nurse on part of our program. We have, as Dr. Wasco mentioned, we have a PA advisors in our program. We're bringing veterinarians part of this program. So we want to make sure we're kind of covering, because the medical industry is so broad. We want to make sure we're covering the gamut, right, to serve our student athletes. And with that, the good essence of time, again, we want to thank you again, Dr. Gay, for taking the time. I know you're very, very busy doing this time, this season that we're in, trying to create the new normal, and definitely your words and comments, will help the student athletes and those who are on this call. I know I've learned some things, right? I'm too old to go to medical school, but if I did, I kind of know what I need to do, right? But I think it's important, right, that we serve our student athletes in the areas of their interest. That's why we say leaders invest, right? So because we need to make sure that we are preparing our student athletes for life after sports. And this is a part of that. And so we really, really excited. Again, Julie, if you could go back to the upcoming webinars, because I want those that are still here. Let me see if she's there. Please take note of these upcoming webinars. Our goal is to host these bi-weekly. So if it's something that you want to know about, and Mia, I know you're there in Eastern Michigan, we always invite you, although we're not having those one-on-one appointments, we invite you and your student athletes over in Eastern Michigan to join us, to get some information, to ask the questions. We are in this together, but please take note of these upcoming webinars. And if it's not for you, if you know someone, a student athlete that's interested in this area, please invite them to come in. Because again, we want to be leaders in best, but we want to make sure we're growing the next generation of our medical professionals.
Speaking to the question that Mia asked before, although we aren't open for one-on-one consultations with people from outside the university, I would be more than willing to meet with people at Eastern Michigan to explain what it is we do and give them advice how they may want to start a similar program.
Exactly.
And to receive, I'm sorry, if I wanted to join in on the webinar series, will the advisor, Kellen Wilson is the one that had sent out the information for today to us. Will she be able to provide the links for the upcoming webinar, or will they still be bi-weekly through the same link? How exactly should I approach that, I guess?
Yes, it will be, great question. It will be bi-weekly through the same link.
Okay, so
Yep.
It should be, not this week, but, it'll be the following Friday?
Yes, ma'am.
Okay, thank you so much.
Good topics. And with that, again, we want to close. I want to wish everyone a restful weekend and go out and enjoy some sun. And if you got to go blue.